Yes, I messaged to the group, but the session is open.
Okay, I am starting the recording, okay? Before starting the class, just let me give a quick introduction, not for myself, but regarding the course, okay? So I don't want to waste, I felt like yesterday we waste one class, okay? So in this course, what all topics you are going to learn and how we are going to deal, okay? And here, Sunday, I'm going to send more than 10 PDFs. 10 PDFs. Hope you have my number. Just Saturday, personal, you can text me. Just a reminder, because I'm handling 3 TTCs. So I'll be like here and there. I should not miss that topic. I should not send here. This topic I should not send there, right? So Sunday, I'm going to send you 3 PDFs. One is like normal anatomy. One is entire the organs like 11 systems, which is like 70 to 80 pages. And another is just normal introduction, because that we are not covering in this topic, because I guess everyone are yoga trainers usually like in 200 hours or 300 hours introduction. What is hatha yoga? Ha means what? Ta means what? Ashtanga yoga or 8 limbs yoga. This all we won't cover here. Based on the topics only we are going to cover. So these 3 PDFs plus I'm going to share you few 2018 3 books which I have written. Total 28 health issues. You can, for everyone, it will be helpful if you can take print out. Okay, that is rough copy, but you can download. It will be useful for you. And then I will share you Sunday, if possible, more than 50 mudras PDF. So anyone want to study from now onwards, you can plan step by step. Okay. And next, what you're going to learn in the course, let me explain. Introduction to yoga therapy. Okay, how we are going to deal entire the course. If any health issue, in which way we are going to handle the case, the patients or clients. And next, understanding various diseases. How we are going to understand the various diseases. Okay. Next, what all things we are going to learn means total organ system overview. Means not too much of deep, but I can give you in PDF in each topic 3 to 4 pages I made. Okay. When coming to the class one-on-one, when we are explaining, we'll get to know in detail. In what all topics you are going to learn there also, I'm going to tell now. Okay. Nervous system, respiratory system, digestion system, skeleton system, muscle system, circulation system, endocrine system, lymph node system, urinal system, reproductive system. 11. If you want, again, please mute. If you want, again, I will repeat. Okay. Again, I will repeat. Nervous system, you can prepare class 1 notes, class 2 notes like that. Respiratory system, digestion system, skeleton system, muscular system, endocrine full. I'm going to send one drive for endoglands. In that, 20 videos will be there with linking of chakras, 6-7 months back videos. Okay. Each topic, like suppose Apana Vayu, it linked with root chakra, right? So how it's going to work on contribution, piles, which is not there in the syllabus also. Few videos will be there. So it will be easy for you. You can download that 20 videos. Okay. And here, next, reproductive system, everything. This you are going to learn in detail. Okay. When I share the PDF, in that each topic, like 3 to 4 pages will be there. Okay. Why means how you're going to pick and draft the case study also I want to see. Okay. And one more thing, out of 18 or 20 or 22, how many topics we are going to cover, that put aside. Which topic you are mostly interested? Pick any 2 topics and you are going to do case study in the 2 topics. You understood? Example, suppose you want to do on thyroid or menstrual or diabetes. How you are going to draft? How you are going to teach your students? You are going to do case study. So thyroid, few other health topics I am going to send end to end. Few I won't send also. Okay. But in class wise, I will tell in detail. Okay. And individual, I'll send the notes. In which way means pranayama and breathing technique, more than 40 you are going to learn. That I'm going to share. Mudras, more than 50 you are going to learn. So in that way, entire this much notes you will have. But what I'm asking you, only from my end, one request. Suppose you want to do spine therapy or otherwise on the joints or sciatica or what to say, like diabetes, liver. Pick any 2 topics. I'm not asking you to draft on all the topics. You got it? And if you check internet, it will be one way, little bit here and there, how I am changing and how I'm explaining also, you're going to understand. Now, what all topics you are going to want to prepare your self notes also, you can text me personal. So few topics, class wise, running recording wise, you are going to prepare. Those like I won't give PDFs. PDFs in sense, you will have everything, but that will be like my run, what to say, like I will show you. Like this type of notes, not like PDF notes. Understood? But if you check PDFs, you'll here and there you'll have, because already I will share more than 30 to 40 pranayama breathing and relaxations 4, meditation 10, mudras 50. You'll have all together, you'll have your notes. You understood? Not separate test, but just if you prepare the case study, usually how we are going to work, we'll understand, right? Suppose you are doing in thyroid, or think you are doing on any like heart related or high BP, low BP, usually how we will do research? We'll plan for 8 weeks or 12 weeks, right? Any like 8 weeks or 12 weeks also, how we are going to handle those things? I will tell you. We'll have like pre-test, mid-test, post-test. Test means before doing on your clients, what all asanas you are going to give, what all mudras you are going to give, what all pranayama you are going to do. That is called pre-test. Control group, non-control group. I'm not asking about who are not, you're not teaching for yoga. No need to plan that. Suppose you are teaching yoga for 20 students or 30 students. In which way you are going to handle? That is called pre-test. Got what I'm saying? You understood, right? Like then midway, means suppose you are doing for thyroid or diabetes, 12 weeks program you are doing, or 8 weeks program you are doing. Mid-test means in between. Suppose you are doing for 12 weeks means after 6th week, what about your client? In thyroid, you are giving like fish, Masya Mudra, Masyendra Asana, Bhujanga Asana, Setubandha Asana, Shanka Mudra, okay, halasana, but she has back pain, they are not able to do. So in which way the health reports, means before joining your class, what is the health condition? Thyroid gland, I mean like T3, T4 or THS, what is the thyroid level? Then mid-test, what is the T2 level? Then post-test, means after 12 weeks, what is their journey? If anyone want to do it. It is really useful for your career. Out of 20 health issues, if you pick 2 also fine in this 1.5 month or 1 month, whatever, because you'll have a clear picture how you are going to handle a client in a therapy way. Okay, why? Because research methodology, how we will use, like first of all, you should understand about the person, then introduction, then symptoms, what is the symptoms, then cause, then effect, then contraindication, precaution, then yoga asanas, pranayama, mudras, relaxation. In this way, each topic you are going to learn. Is it clear what I'm saying? Still I didn't start a course. I'm saying what I'm going to do. Okay, fine. Sample ways I can give you, like we are working on pituitary gland or thymus gland. If thymus gland, if anyone want to do, let me know. I can help with my second PhD topic is thymus gland only. So I can help you with how to balance those things. Usually it will work on your immunity system, autoimmunity system, that glands and all, it will work. So even we are going to do in online also, no problem. We are going to do water meditation, fire meditation, other meditations also we are going to do. Okay. And how we are going to work on remaining things also, step by step we are going to do. And visualization techniques. Thymus gland. Yes, thymus gland we all need. Okay. Okay, fine. No problem. I will cover. I will send you notes. No problem. But that is not separate PDF. I have, otherwise I'll share my running notes. No problem. Okay. Now, to understand step by step, even I guess all are like trainers or health coaches, means you will know about visualization, how positive lines we are going to send to teach the client. Okay. That also most important. In this way, we are going to handle entire course. Any doubts? Overview, how I'm going to start the course. I was just giving an outer line. So you'll get one idea. Okay, this is what you are going to learn. If it is fine, now I'm going to start. Any doubts, you can unmute and you can ask me. No, thumbs up, thumbs up, thumbs up. Fine. Now I'll tell you like PCOD, PCOS, lungs, liver, kidney. These topics by Preeti. I will be there in the camera or camera off. These topics by Preeti. She is from US, from Dallas. She is going to handle. Okay. And muscular system. 1 second, the paper, if I see you, I'll get to know which trainer is topic. Okay. Muscular system, skeleton system, back system. Okay, means the issues in which way I can say like back pain, knee pain, shoulder pain, sciatica pain, joint pain, ortho related problem, your veins. These all by Sarita from Delhi. Okay, she is from Delhi. Remaining entire by me only. Okay, fine. But for those classes also, I will be there. My camera will be off. Okay, before going to their classes, I want to do in another way to make you more easy. Okay, every day, like first 5 classes or 8 classes, if theory, you may feel little bit bore here and there. So after 1-2 classes later, we will start thyroid and menstrual cramp. Then after that, what we are going to do, you will learn entire pranayama mudras. This will take 10 to 12 classes. Otherwise, in between, if you feel bored, I will do my topics like diabetes or high BP, low BP and all. Why I'm saying means, at a stretch, if I finish all pranayama, then they won't cover. Suppose for thyroid, you want or PCOD or pelvic they are doing, or otherwise like kidney. Again, they won't say kidney mudra, makara mudra, matangi mudra, or grandhita mudra. They won't cover. So when I am doing my thing, entire separate the mudras and pranayama. And when I'll explain in detail, I will tell why this mudra, how it is working, in which journal came, from Gayatri Mantra, 14th 𝐕𝐨𝐥𝐢𝐧, everything I'm going to explain. If you want mudras also, 50-60 mudras also, if I want to share means, I guess another 10 to 11 PDFs. All together I can share, but I have to check with Rajiv when to send. Okay. So once we are done with the pranayama mudras, then we start other topics. For you, it will become easy. Acha, this is like pranayama, it will work. Usually like high BP and diabetes combination, they can't do like Bhastirika, Kapalbhaiti. So before only if I cover, when their topics will start, it will become easy. Is it fine with you? Or you want pranayama mudras last? Let me know. Anything is okay for me. Anyhow, I had to cover.
I think you know best.
Little bit smile.
We'll go according to you.
Otherwise, I'll feel that don't feel like I'm a teacher. You are all a student. All are equal here. You are some topic you may best, and some topic I am best. I may learn from you something like that. Okay. If you won't smile, I will feel in which way to whom I'm teaching. Also, I'll get confused, right? Okay. Now let me start. What is yoga? Already in the last class, like we are done yoga therapy, from where it came, how it came, who it said, 1986, all. Again, I'm going to repeat because I'm seeing some new faces. Okay. So what is yoga? We all know. See, already with 200 hours, 300 hours, what syllabus here we are not covering. And one more thing, if anyone are very interested, please go and check my Facebook. I'm not there in any other social media. Koshas, chakras, more than 180 posters with in detail. Just now, how I said, the posters, not only steps, each asana, which vayu will work, which chakra will work, which dosha will work, which kosha will work. In that way, I have written with body parts, organs, therapy wise. You can check my Facebook. More than 180 asanas in detail, for theory plus photos will be there. Okay. Yoga, we all know, is a word of union. What that actually, body posture, asana, controlling breathing, meditation, or mantras, these all are linked only yoga. If you ask me, types of yoga means we should understand what all the different types, right? Physical, mental, emotional, like knowledge sake or spiritual sake, different people will say, like Bhakti Yoga, Hatha Yoga, Ashtanga Yoga, Kundalini Yoga. We'll talk a lot, right? So which is in which category? This is called as types of yoga. See, just an outer line I'm going. Still, we didn't start our topic actually. Types of yoga. Physical, what we are doing only the original, if you ask me, Hatha Yoga. Later on only it came like step by step changing in the different way, like came Ashtanga, Vinyasa. Just 15-20 years back only pregnancy yoga came. Okay, this all now we are seeing, right? Power yoga. The otherwise, where it is like only which we have only the thing of particular portion of original text is Hatha yoga only, right? You all will agree with me, I'm thinking. Mental condition means, see, anything if you ask me personal, I personally will use to understand because my personal experience when I was so low or dull, I used to come up think means physically, if you are weak, also you can do so many things when you are mentally strong. I personally feel because hope if you watch the first webinar, my introduction was done on that day. Again, don't want to say again, and I don't want to make you guys bore. Okay, mental related types means which like anxiety, depression, fear, frustration. This topic is my favorite because I learned this a lot in last 5 to 6 years, which is like CBT therapy. Anyone are interested, not for including in therapy, and I'm not asking for any fee. I can share the notes personal. You can text me personal, not in the group. Don't disturb the group. Regarding the topic only, we are sharing the notes. Anything else, if you want, text me personal. Even prenatal or Pilates, anything, what I know, I can help you. This mental related things are linked with the Raja Yoga. If you feel class little bit speed, let me know. I will go slow also. Instead of 32 classes, we'll go 35 classes. What is there? I will type also. Otherwise, anyone can take initiation and they can draft like this. See how I'm drafting in chat box. They can do like this. So it will be helpful. Anyone in prenatal also they will do. In there, 2-3 trainers will do. Emotional factors are linked with what? Bhakti yoga. So in Bhakti Yoga only, the most like mantras, chanting, all this will like we know so many mantras, but which is first mantra we have to chant, which is last mantra. Usually our class will start with prayer or om chanting, right? This all will category in that. Coming to intelligent, like we can say in koshas of linking of Vijnanamaya kosha, right? This is linked with Chan, J-N-A-N-N-A. Yoga word you write again every time for me it will different. Spiritual basic like karmas, like karma yoga. How many karmas are there? I mean, like we'll talk, right? Sanchita, prarabdha, like that. Anyone unmute and tell. Talk. How many karmas? 1, 2, 3, 4, 5, 6, 7.
3
Tell.
karmas. 4.
Tell. Say some answer.
Prarabdha karma, Sanchita karma, Agami karma. And
So Mahati said answer is 7. But that is out of the box na. I mean, syllabus mein nahi hai. If you want, once I have finished prenatal, then I'll have enough time. I can teach up to 8:30 also, no problem. 7. I too don't know when I did my MPhil for that entrance exam, we have to prepare, right? How like we will do for UGC net and all. Then I came to know Krishna karma, Nishkamika karma, which you will do for yourself. We should not hurt others. Even in Bhagavad Gita, Lord Krishna will tell to Arjuna, total 7 karmas, okay? Here, when we do all those things, what are the changes actually, like physical changes, mental changes, history of yoga, step by step, we will see. Psychological changes, this will be there, right? You'll do nice Sirsasana or otherwise Sarvangasana. Postures wise, we are very good. But how it is affecting our body, we should have an idea. You ask me, rather than today, 5th class and 6th class, I'll be more happy. Why means, if you understood about the Pancha Pranas, based on the Pranas only, I'm going to, usually I will draft in that way asanas, which I learned from my grandfather. Okay, now, next thing is, Patafat will finish this. So at least today I want to cover 2 topics of, check the chat box, what I'm drafting, so it will be easy for you. Otherwise, anyone can take a screenshot, which I mentioned there. Can anyone can read? Unmute and read. Or say
physiological benefits.
psychological benefits. Usually when you do therapy, how your client is benefit psychological way, mental way, emotional way, spiritual way. We know in yoga, we will talk about 3 bodies like physical body, astral body, causal body. That is not linked here, just I'm saying physical body means which we know you will do perform the asanas. In Ashtanga yoga, we know all asanas in which category and all. Okay, like that here, how it is linking, that is most important. That science and the yoga, the connection we are going to learn here, right? Here the benefits is first on affecting on nervous system. It will benefit on the nervous system. That's the reason in the organic system, organ system overview, I'm going to share that PDF. If you want right away, today 10 o'clock I can share. In that, first I have mentioned only nervous system, because the brain, other things, how it is going to work, the functions here in the nervous system is what, like thoughts, memory, learning, feeling, your emotions, how it will affect. That is first one. First one is what? Effect on the nervous system, NS. You can type, someone can type, so I can feel like, okay, at least 1-2 people are listening to my class. Okay, next is, first one is nervous system. There is in chart box, no one didn't wrote. Next, second one, effect on CVS. What is CVS? CVS. No idea? Don't say like, we joined this course to learn with you. Don't ask questions.
Cardiovascular system.
Circulating system. Circulating system. Here the circulate means shortcuts means it will become easy enough for us. We used to learn in that way, instead of remembering like what to say Sanskrit name like Ashtanga, otherwise Sarvangasana, Halasana, Sirasasana. We'll say headstand, done, over. Merudandasana, for that what we'll say like upright seated angles. Nowadays in English names it's easy, right? Here circulation system I am going to handle. Here you are going to learn in detail about high BP, low BP, heart problem. How heart work with the 4 chambers. Then here just try to correlate how it is linking. Here heart, no, put aside about the 4 chambers. Let us link with yoga in which way. Again, we are going to learn individual. Here, which vayu is working? Which chakra is working? Can anyone? Easy, na? Heart means what? Heart chakra, what is the name in Sanskrit?
Anahata.
Very good.
Chakra.
Which vayu? Which vayu?
Udan vayu.
Hey.
Sorry.
Prana.
Very good.
Pranavayu.
Pranavayu. Pran is throat. Prana. Okay, I will do one thing. Vayus also I will send PDF, but not notes PDF. That I will send my my handwriting PDF. Then okay, chakra done there, vayu done. What about which dosha in Vata, Pitta, Kapha? Which dosha will link with heart chakra? This batch has so many beautiful ladies are there. My first line all are beautiful. What, sir?
Kapha.
Vata. Heart and throat is linked with Vata. Next, which kosha? I mean, we know 5 layers in our body, right? Kosha also not linked in therapy. If you want, I will share the notes. Okay.
Okay, ma'am.
Now, which kosha? See, Annamaya kosha is first one. First one is linked with 3, like Mooladhara, Swadhisthana, and next one is what? Manipura, Annamaya. Here, Pranavayu. So, Pranamaya kosha. If you want in detail, I will send you koshas in group itself. No problem. For everyone, it will be useful. Little bit link only, right? So that's what I am saying. Each asana also separate we will do 60. Not like suppose for heart you are learning 25. Think for high BP you are learning 30. Think for low BP you are learning some number. Put aside. Later 150 or 40 or 60. Anyone are good in asanas. I will do 5 counts and I'll come and I'll sit here. I can place you guys in 2 or 3 members in a screen and spotlight. When you do example, I'll give tree pose or triangle pose. Okay. Or Padahastasana. When you do, I'll explain which chakra will work, which kosha will work, which organs will work, which therapy parts will work. I guess it will be like in detail more than sufficient, right? Not only for this 15 or 20 or 25 health issues. So you'll get to know. For that, I will send you one video. First, you be get ready with in that video 38 asanas will be there. Enter the video by me only. All are easy. If you are good in advanced asana, that all are basic from Hatha Yoga. Okay. So second point over, right? Heart and body. Okay, please note like linking kosha, vayu will be helpful. Fine. Next one. Efforts on the respiratory system. Respiratory system is linked with what all things like blood circulation. Okay, and here the circulation will travel to link with your which endogland. It will work on the 3 to 4 glands actually. Okay, so when it comes to the circulation, that's why endoglands one entire one video I'm sending you, drive, download, you will get 20 classes there. Okay, then effort on the skeleton muscle system. Skeleton and muscle system. This is your fifth point, which for this only, I guess, 1 second, where is the paper? Syllabus paper. Ayyo, 1 second. I remember back, shoulder. Where is it? 1 second. Back, shoulder, sciatica, the skeleton, muscle system. This always Sarita. Okay. And then next comes to digestion system. Effort on digestion system means what all here will work? Samana vayu. When working on the samana vayu, usually it will work on your pancreas, intestines, downside back, again kidney. And samana vayu is working with Manipura chakra, right now. Then here, when it comes to the work, samana is balancing fire and water element. Fire, we all know Manipura. Water is what? Swadhisthana, right? So here pitta and kapha element will work. So if you want in detail for the asanas also, I can help you in this way. You let me know. Otherwise, topic, introduction, cause, effect, symptoms, if I teach also, it will take 20-25 minutes. Then jumping into the asanas also, 40 minutes, and next class, if any pending asanas, I can finish. But you want each asana to explain in this way, I will go in that way also, not an issue. Otherwise, we can finish entire 4 or 5 classes special. We can finish 50 or 60 separate. Again, we can do with the asanas. This is what all I said: nervous system, respiratory system, metabolism, skeleton and muscle system, digestion system. These are the benefits of what? Till now, what I was saying. No.
Muscular and bone systems.
No, Mahati, wrong. In chat box, what we have written first one. Very good. Very good. Super Bhakti. Okay. So, next one. Yoga means what? We have all idea of connection with physical, mental, spiritual with the discipline. That India in how and all. And coming to like, before moving into further topic, modern history in which way the yoga came. Who wrote all those things and how it came like a therapy in the starting earlier years. Means to India. I'm not talking about the US or other things. Here, the first Indian teacher to activate I can say one of the audience, and he is somewhere I read not only yoga, he is an advocate also, Swami Vivekananda. When he traveled in Europe with United States, started around 1890s. If you want, I can send some screenshot, particular year. So you want to search in internet to do your homework, or further you want some more detailed points. Let me know, no problem. I can post in the group or personal also. Okay. When he traveled in the tour like Europe and United States in 1890s. Okay. They forms like 5 basic principles. Even in our class also, what we will do, we'll start our class, if suppose 1 hour class, how we will design our class, like warm up, Surya Namaskar, standing asanas, sitting asanas, laying down, twisting, relaxing, cooling down, then any like relaxation or meditation, something. Right now, you all will agree what I said, or anything else you're doing. This pattern only, if you want to do basic, you will pick, or intermediate or advanced, or whatever journal you're doing. Suppose you're doing Ashtanga yoga or power yoga. But in your class, this 16 or 18 asanas when you plan, we will cover standing, forward bend, backward bend, sitting, right? So the modern yoga has, based on the 5 principles, proper relaxation is important, right? And we will do instant relaxation, quick relaxation, deep relaxation. If you have notes, okay. Otherwise, no problem. Let me know. I will post that one also. If you want me to teach, I will teach also. Okay. Try to add one more PMR, progress muscle relaxation. That is most important here. We will work on this because muscles should relax. Therapy, right? We are adding few things extra. And proper exercise means why I use the word of exercise. Usually, I'm totally opposed of the gym. I never stepped into the gym. I will eat nicely and I'll do. But here, when you work, even you can understand about your client and you can go with the cardio. Otherwise, postnatal, if you're doing the core strength, they will cut the C-section means they'll cut the stomach, right? 6 layers they'll cut. Again, to engage that, the recti muscles, DR recti will say. For that, how you will engage. So again, we have to work off the core muscles. So definitely few people will add exercise of cardio related or muscle strengthening or Pilates like that. They are going to add. That's the reason I was adding here proper exercise. And the most important thing we all know, like whatever asana you're doing, proper breathing is important. You'll agree, right? Without that, where to inhale, where to exhale, when to hold, where to pause. This all you are familiar, I guess. And I will say, like, all will agree with me, like proper diet. But if you ask me, I never follow, I keep on eating only. But saying, I can say, that's this positive thinking and meditation. Positive thinking, I will agree. Well, because if we are weak in thinking of positive, then what? Then there itself, half of the things gone. If physically, if you are weak, also if you are mentally or strong, definitely you can do the things, right? History of yoga therapy. Yoga made us the way from United States and slowly it merged in India with Swami Vivekananda and next it came in the late in 80s and then 1980s with, let me draft this name. So you want to check in internet, you can check and you can do a little more homework. So I'm not drafting Swami Vivekananda because you all know that. Yeah, I'll draft this name so you can check. Oh, sorry. Next, some name is there. OMISH. Dr. 𝐕𝐨𝐲𝐲. Okay, I guess in chat box you saw the name. Anyone can spell?
Dr. 𝐕𝐨𝐲𝐲.
1980s in United States and Europe with Swami Vivekananda, they started. Okay. Next, 1983. Because whatever we are learning, we should know na, when, what, how. This is from Biomedical Yoga Trust. What? Who will type speed? Really,
Biomedical Yoga Test.
yes. No, someone can type speed because my right hand problem. Don't type anything in the WhatsApp chat. Type in Zoom, so it will be helpful for everyone. And International Association of Yoga Therapy, IAYT, was founded in 1989. Okay, both organizations started slowly, then they started yoga therapy. What is yoga therapy? Now we will start. We know yoga, how we will do asanas and all. Now, to understand what is yoga. Suppose who here so many ladies I'm seeing nice smile. Are my first line all are white dresses only more. Who is good in cooking? Just an example I will give so you can correlate your yoga therapy for your cooking. No one. Past 5 years I am not cooking because my mom will cook something. No one.
I am.
Okay. Bhakti said yes, someone. Okay, you at least you can cook some aloo fry or chicken, mutton, one recipe, right? But that recipe, what you will do first? What we did? Hey, come on, I want
Think
smiling
all-
faces.
Chop all the ingredients, keep everything ready.
Anyhow, after 2-3 classes later, I go back, place my mat, come friend, do here and there. Then I can't do like this. At least first 2 classes, smiling faces. And
All
wait,
the
wait.
preparation is to be done before.
Yes, wait, Bhakti. I will spotlight
Yep.
and I'll ask. Come on, tell me, you know any cooking? She's looking so young, na? Maybe she don't know cooking, I guess. You don't know cooking? Coffee, tea, kuch chai vagera? To you only. You are in the spotlight, right? To you only. Dal kuch. You know something?
I know.
What you know? Tell me.
I can cook everything like
Everything. Just can you give in 1 minute mein kuch like dal tadka or rasam? Oh, by looking
the
sorry,
recipe.
looking like North Indian. Sorry, how can I can ask like rasam? Something. What you will do? You need onions or chopped vegetables
Yeah,
or stew like.
for the preparation.
Then
First, we should know the recipe and
before
the
recipe.
preparation.
Before recipe.
We should have all the
I will tell you one
know
thing.
what to make.
You suppose I met you. What you will ask me? Coffee, tea, something you will offer me, right? So what you will ask? You will ask my interest. I mean, which I like coffee,
What do you
tea.
like? Yeah.
So I will say coffee.
Yeah.
Then first thing you should know about what the person want, right? Then next what you are going to do? Then for
Look,
coffee, what required?
look for the ingredients.
Milk, coffee powder,
Milk, sugar, coffee
sugar,
powder.
then boiling, right? Then everything should be in a proper way, like ratio and everything. Then only done. So I took very simple example of coffee, thank God. If it is more than that, again, it will become difficult. So in the same way, you should understand your client health case history. Got it? So like medical history, family history. Suppose in pregnancy also, I keep on saying my team, I will say. I won't say like students, because all are teachers here. I keep on saying you should understand in pregnancy also like 14 health issues are there. But that student has that 14 or any one will be there. In pregnancy, diabetes will be there. In pregnancy, thyroid will be there. Back pain will be there. Like that, you should understand your client case history. I mean, like medical history. And next, family history. Suppose diabetes, this will be the family history. 𝐘𝐨𝐬𝐧, when, like that. Then you should understand what we are going to do. Unlocking the hidden means few people, they will say, okay, I have this. But you are working on thyroid or diabetes or constipation, you are working. But it is, they are not happy, you are not happy, the result is not coming. Why? Family history, okay. Medical history, okay. But something is missing, which we both are working. Both means the trainer and student are working, but the result you are not getting in 3 months or 2 months. Okay, let me make you more simple. The client came for, usually I'm specialist in infertility, pregnancy, right? I will give that example. One client came, she's planning for pregnancy, 3 months over, 4 months over, but she is not pregnant. They are trying. Health issues, what she said for PCOD or PCOS. So that we are figuring out, but still she is not. Why? What's the reason behind that? Medical history I came to know, family history I came to know, but what is the third one, which is missing for everyone?
But in case of pregnancy, where they are trying and they are not able to conceive, it could also be a combined problem of the husband as well, right? It cannot
Ma'am, that I will agree. Just general example I gave. Then I had to change think like diabetes only. Yeah, very good. Emotional or mental blockages. Who have written? Very good. Super answer. Here, same thing we have to release. Emotional means yoga is not only physical, the emotional well-being only we are going to learn here. For emotional well-being, what we are going to do? You know most of the pranayamas, but different techniques we are going to use for lifestyle is food or sleep, that we will talk later. That is simple, but that we have to manage. But how much being a trainer you are going to help your student is most important. That's what a mudras 50 plus you are going to learn. Combinations for stress, anxiety, fear, depression, blockages, means they want to shout, they want to cry, but they can't open up. So first, trainer should understand with the more patients, they're relieving you. You should not relieve their secrets, right? Someone said, these are the things I want to do. Then if woman has blockage, so, I will read all the chat messages later. Just give me 2 minutes time. Western culture is different. How we are collating with different things are different. So blockages are nothing but chakra blockages will be there. Emotional blockages will be there. Spiritually, how we are going to link up. Mantras I'm going to give. We are going to do meditation with the simple to difficult also. Okay. Combination works we were going to do with the blockages of emotional and mental. Okay. By the combination, different techniques such as stretching will work, massaging will work, pressing your ears, rubbing your eyes. This all also I'm going to give. Okay. Next, in which way, even we know why people usually they'll say my neck is paining, my shoulder is paining. Don't give this example like maybe working for longer hours in IT, people will say. That is one thing we will discuss later because of the wrong posture and all. But usually when they're saying like neck, shoulder, or the back side, upper, if they have health issue, fine. Because here I can say your throat chakra, the Vishuddhi chakra is linked with your fear, anger, depression, frustration, emotion. Means air is traveling upward, Udan Vayu. That's the reason most of, not in India, out of 10, 7 to 8 people are suffering with thyroid. If anyone want to do for thyroid, if you check internet, you will have 18 asanas. I can give more than 30 with the variations. So text me personal. I will share all the photo. Tonight I can't do, but at least tomorrow, like before 3, I can share with you. So it will be easy for you. Okay, chalo, let me work on issues treated by yoga therapy. What all things? When comes the air from here to here, it is working, right? Usually, okay, let me spotlight myself. I will show you one. See, I was talking about this. This is thyroid chakra, right? This, when we talk about T3, T4, hypothyroid, one is weight loss, one is weight gain, right? We will discuss on thyroid topic on that time. But when it comes to this, from your ear, 3 fingers up, this is pituitary gland, and here comes pineal gland. When it works on pituitary and pineal gland, what happens, PTSD, post-traumatic stress disorder problem also nowadays in India, most of the people are suffering. You can't believe it. US and all, they will agree. But in India, people won't agree. What you're saying, I have post-trauma disorder. Why you're saying like that? That's the reason if you go for counseling classes, they will charge nicely for 1 hour, 1,200, 1,300, like that. First one is depression, anxiety, issues treated by yoga therapy. Side heading, you can draft depression. Depression, again, it link with one more point I want to tell. Not only Udan Vayu, Vyana Vayu is linking with entire body, right? You all know. If you want little more information on the Vayus, let me know. I will go deeper. Vyana is traveling entire the body, means hands, legs and all. But Vyana Vayu connection with which chakra? It is traveling entire the body. It's going to the chakra connection is Swadhisthana chakra. Like that, if you want a little more information more, let me know. Before pranayama, I will help. No problem. Okay. So here, when it comes to the throat, ear, nose, eyes, upper, means the indriyas, except the skin is linked with Mooladhara, root. Remaining all, if you see eyes, nose, mouth, brain, these all are linking with traveling of what air? Udan Vayu, air traveling upward. Okay. So here, depression, anxiety, PTSD. Okay. Next, nowadays, in kids, we are seeing what problem? Special kids that in schools, colleges, what they're saying, like children with autism, otherwise ADHD problem, otherwise like health issue, like if you go with a general thing like back pain, heart, gas, not only up, what you'll say in Hindi, Dakar, upar se aata hai na? And when it comes to the down, you have to work on Apana Vayu. Apana Vayu is linked with conjugation, piles, anal muscle. Like you all know, like we will do with Ashwini Mudra or Kegel exercise. These all are linked with Apana Vayu. Okay. Hypertension, again linked with Udan. Asthma will work on bronchial tube, asthma, high BP. These all related of heart opening. Okay. Issues treated by yoga therapy. This all you can deal to your clients. So you need to work hard, not in asanas. If I show asanas, Smita, I know, you'll tell. Then where to work? Mudras. That's the reason my favorite is mudras. Mudras in Ashtanga Yoga, Pratyahara mudras will come. Okay. What to expect from the yoga therapy? See, I join as a student from you. So here all are there. Usually when I join, what I will expect from you, I'll stay with you for 3 months. Usually any client is joining, what you're going to explain, we'll think, let me hold the client for 4 to 5 months, at least minimum 6 months. For that, what you're going to design your classes, it should be like somewhere little bit interest, right? So what to expect from yoga therapy? Okay, see, these all topics you are learning, but when the student comes, what they are expecting from you as a therapist. Okay, when a person is decided to learn something with any health issues like liver or lungs or hernia have 5 different types, gents 3, ladies 2. So step by step you are going to learn. Just I'm saying, they will feel whether my teacher or my mentor or therapist identify the health problem in a perfect way. First one. Next, what you'll say, if then what happens? Accessing the lifestyle and physical capacity. If we are good in asanas, you will tell. Lifestyle means you will tell, okay, sleep for 8 hours, eat this food, eat that food. But one more suggestion, I'm not that much good, I can help. But next month for a prenatal and for other courses, we have one free class for nutrition. You can join for that seminar. Okay, Vata health type, what food you have to eat. Pitta health, what food you have to eat. Kapha, when you know this, then it will become very easy to handle your client. Right? See, I know my body type is Kapha, but I don't know about your body type, then how you are going to handle. That is also important, right? We are going to deal with asanas, mudras, pranayama, relaxation, meditation, even massaging. I'll tell if you want Varma Kalai. I learned that one also. Varma, which for PCOD, PCOS, only for women health issues I learned. Diseases, these are reasoning for seeking for therapy. How you are the course you are going to treat. Suppose you will tell, you stay here for 12 weeks, then only you can understand about this. We are going to identify, we'll work on this with the pranayama or otherwise asanas or otherwise you are going to give meditations. Then they will ask you benefits of my course is what? Okay, you will start something. Then you should also have an idea, right? Benefits of yoga therapy. Here in course also you're going to learn. When they'll practice, you can't remember all the mudras, few important mudras are there. How in general classes also for women will say, you do Setu Bandhasan for 1 minute. Why? People will talk about thyroid, people will talk about PCOD, PCOS. Then they will say it is good for diabetes. But why? You ever thought? Here, when it is bending, Udan Vayu is working. When it is hip is open, it is working on your Apana. When it is traveling up, in between, it is working on Samana. In the Vayu ways, we are drafting. Then when you realize, Acha, here this Vayu is working. So I'm drafting in this way. Here, my client twisting, I can't give. So I will change. In which way? So here, blood circulation will be perfect when they start doing therapy. And pulse rate means heart rate will be there, right? Up, down, up, down, up, down. It will be normal. Circulation means blood cells or mind like a beta, alpha, theta, delta means when you do meditation, when you're deep, suppose you like comedy movie or nice romantic movie or anything which your favorite you are watching, you will be 100% you will put on mind there, right? You will be engaged, right? Say then you won't think anything like on that time our blood flow will be more active, more enthused. Your hormones of happy hormones will release. Happy hormones means what? Dopamine, like that. Stress hormones means what? Cortisol, this all. You're going to learn those things also. When I'm stress is not given, but I want to deal because most of the people, I have no idea, but you have Instagram means you'll have definitely you'll go with stress management, right? Otherwise, that notes also I can post by seeing asanas. If you have idea, fine. What to say, like coming to mudras, if you have no idea, I'm going to help you, no problem. And when you practice yoga therapy, your organs will be proper. Touched, I have no feel to say my age, 42 years, no health issue till date. Touched, thank God. Till now, I didn't went for any health, for a hospital for any complaint. Only for eating chocolates and cakes only I'll go for a teeth complaint, but otherwise my health is perfect. Your immunity will be good, metabolism system will be good. These all I can say like benefits. Strength will be good, posture element, everything, energy, weight, sleep, balance, core, aging. Just now I told my age also. So you can calculate in that way. But in that, what we have to understand. Means usually when you teach something, we will do, right? Precautions. Right? You all agree? So in which way we have to take care? First, this is online. Then 100 times we have to place your yoga mat proper. If you're offline means you can help your student, client. Awareness most important. Instead of if offline, if you're teaching 15 asanas, here it will go 10 only because back come, front come, and again you have to check the line elements. Then most important thing, if you ask me, breathing. In therapy, few techniques are there like butterfly breathing, 5-5, and Buddha. How many? See here, I'm seeing one trainer. Hairstyle is very nice. Just bam, if you won't feel, just I'm spotlighting you. See, nice, na? Okay, just I spotlighted because see how in parlors, general example I'm giving like facials or hair smoothing, Botox. These words you have heard somewhere, right? Touchwood, haircut I will do every 3 months. Facial, it is been like 8 years over. Okay, same way in breathing, we have one Botox breathing is there. If you have idea, fine. Otherwise, if you want, I will teach that one also. How it will improve your circulation to blood circulation, nervous system, respiratory system, and your reproductive system also. So how it is going to work. And most important, you all know that we are going to say like yoga is, we have to practice with empty stomach, or otherwise evening if you are doing, give gap of 2 to 3 hours like that, and routine what you are going to do. Coming to emotional health benefits. See, benefits that was done, which was done, precautions was done, like benefits was done. Now emotional health benefits, mood swings. If you're housewife or working woman, if you have 1 or 2 kids, usually we have a different mood swings. One day we'll be active, one day. I don't want to ask any of the personal stories here. So how the stress levels. So for stress, if you want to calculate TSS, this one I don't know, just 4 years back I came to know when I started doing my PhD, the scale of stress, how we are going to calculate. My professor, he taught me. If you want that one also, I can help you. The opposite person, how in which scale the stress is there, how you are going to do with yoga, how you are going to help with yoga. So anxiety, emotional health benefits, depression, self-emotions. I mean like people will feel we are like women basically in India. What? I don't know because I'm 1983 born, right? On that generation people, now 90s, 20s means now independent more and all. Like it just compromise, sacrifice on that. Now, array, you are earning 50, I'm earning 50. If I don't want, get out. Now, like priority in the self-career, so many things. If it is not matching, chalo, you go, I go, like that, right? So here, what you should understand, self-control is most important. So these all are emotional health benefits. That in which way will connect mind-body connection. Hope you all have an idea about mindfulness talks, mind visualization. Otherwise, I can say like a meditations, positive outlook in life, in which way it will work. That also most important, right? Then only we'll get to know, right? This all comes in emotional benefits. Coming to postures, I mean exercise when you do, how health will benefit. Right now, suppose anyone have habit about doing Surya Namaskar 10 sets or 15 sets, some rounds. Anyone have habit or no? Something I want to shake. I know. No, fine, no problem. Some otherwise regular practice of what you're doing. Some asanas regular like Hanuman asana. Otherwise, what you're going to do? Not somewhat self practice. You guys won't do anything like here and there, like Setu Bandhasana, Sarvangasana. Something when you do self practice, what you'll feel, which nerves will be good? Your PNS. PNS means what? Okay, I will tell in yoga way. Ida and Pingda Nadi. 2 nadis mean 2 nadis. We have 3 nadis, right, left, and center. Right nostril, left nostril, center nostril. I mean center, which is like Ida, Pingla, and Shushma Nadi. Right? Okay. Then before pranayama, I will explain this also. Very simple. 1 second. It's my mistake. I have to place that one also. Then yeah, usually with this sharing screen, if I place and if I teach, that will be in different way, but I don't like in that way. See, this is your right side, this is your left side, then this is your center. If you check in internet or somewhere, we'll know so many things like father, mother, connection and all. That we will tell in pregnancy. But coming to normal, this is muscular and this is female. Ganga, Yamuna, Saraswati. Okay, your PNS, SNS, CNS, para systematic nervous system. This is center is Sushma Nadi, which is called center nervous system. So which Nadi is working in which way, and what all health issues will cover, and what organs will cover, and it starts with which chakra. Before pranayam we'll discuss. Okay, is it fine? Again, if I started now, then topic will be jumping. Now just introduction only I'm teaching. So when you start doing on the posters, health benefits or exercises, what happens? Low risk of injury. By means you are teaching your student like titiliyas, butterfly, or Bhujangasana. So you know how to handle your student in which way. Okay, they have shoulder this one, otherwise pelvic this problem. So how I'm going to deal. So you'll have clear picture. Next, it will be good on your PNS. Then slowly when you start giving like upward plank, reverse table, thyroid, it will work for reverse table actually. Then what happens? Muscle toning. And you started adding plank poses. Plank, hope you all know, na Kumbhasana. This plank have 18 variations. In a day one, we can't teach, but slowly 10 seconds, 20 seconds, 30 seconds, then 1 minute, then the muscle will start tuning up. Okay, then breathing, joint range of motion will work. Interaction with your mind, body connection also. So if you ask me, anyone can hold the posture of 5 minutes, 10 minutes, anyone, any easy posture also. No. Lakshmi Garu, no. From Hyderabad, yes, no, something.
Yeah, Vajrasana or Padmasana.
Kitna minute?
Vajrasana I can hold for 20 minutes.
Oh, super. Upavishta Konasana I can hold for 8 minutes because I become old, na. So today only I did for 6 minutes. So I can say, if I give a little bit try, I can go with 8 minutes, I'm thinking. But today I hold it for Upavishta Konasana means straddle. 6 minutes I hold it today. Okay. Then coming to disease prevention. Let me draft the side heading. You can prepare your own notes happily. Okay. Usually this all what happens here. Heart rate will work here. And diabetes will work here. Next, anyone have idea about OAAI? What the shortcuts we will use for which health issue? Usually your general classes also, your students have this. I'll give a hint. Joints. Now you tell me which health name. Okay, let me drop the shortcut. Okay, I will drop the name only. I don't want to waste time.
Arthritis.
One second. My type is slow. Okay.
Arthritis.
Osteoarthritis.
These all are the disease prevention, okay? Heart rate, diabetes, this all. So before that, we should understand the symptoms to reductions, right? In which way, if suppose the person have asthma, multiple, in which way we are going to do. For asthma in mudras, you have only 2 mudras. One is asthma mudra, one is bronchial mudra. Only asthma mudra you will give for asthma patient, not for anyone. Okay, like that. If a muscle problem or menopause, OCD. I came to know in this 4 or 5 doctors also there. Then even I was tense and I was like little bit more how I'm going to explain because all like a big profile like that. But no one are not talking. What is this? Sir, yeah, sir.
Madam, I'm here.
Yeah, sir. That's why I'm saying by seeing you only I said OCD. Not cleaning wala OCD.
Obsessive compulsive disorder. Obsessive compulsive disorders.
Very good. Super, super. See, okay. Let me type. See, not only with me, you can learn with the group as a team. But I want to tell thank you to everyone. Today was the first class, then my power gone. But you all guys, okay? These are all the symptoms which you need to understand. Coming to the mental instability, that usually if a person have mental instability, what kind of negative triggers in the mind? You heard about bipolar. With the bipolar, even I don't want to go in a deeper way. It occurs in the mid-teen, otherwise anything. Few people will do into like a extreme, like they have a tendency of suicide also. Recently, one of my students' sister's daughter, her age is 28 years. With bipolar, she did suicide, her age is 28. Was done in Hyderabad, but my student is in Mysore. Okay. And I will give here few other names. You can be more careful to handle this type of things. Usually if I type that death words only, I'll get scared to type. Someone can read what I'm typing here, so I can feel at least you guys are interacting with me.
To the death,
Okay.
psychosis,
Confuse, anyone can type, fatafat, I'll tell you. Confuse, increase anxiety, panic attacks. When a person will attack panic attacks, what we are going to do? On that type, 3 mudras are there and 4 breathing techniques are there. Even one of my clients' brother, not now, 2015, he got a heart problem in Narayana. They told they have to change the heart itself immediately. He's working in Infosys. We have till now, they didn't do heart operation. With yoga therapy only, it is going on. Suicide pattern, depression, feeling to multiple mind sort of, I'm not confident. I can't do anything. Self-important. So this type of things means they'll get headache. Temporary blindness also they'll get migraine, vertigo. These are the mental things. Okay. And coming to one more thing I'll tell you. For migraine, we have one mudra. Even in asanas, it won't work also. Mudra will work. Mahasirs mudra. If you give your clients for vertigo and all for 8 to 6 minutes, definitely the headache will reduce. So that's the reason I asked first, shall I complete like pranayama and mudras so you can prepare your notes? And my notes may all in detail is there, only pictures you have to click and you have to paste. Yoga therapy is the useful in a specific yoga way. Yoga can help people to heal. What all ways it will heal? First point we'll say based on our teachers, we'll tell flexibility and strength. You all will agree or not. But when you get this certificate, the flexibility word, that benefit you put in a 3 or a 4, because now you can say you're a therapist, right? General trainer means we'll talk about flexibility, stamina, strength. And if you check in internet, yoga benefits, first point, they'll say like increasing flexibility on, right? But here we'll talk about improve your immunity functions. Apana vayu mudra, prana mudra, surabhi mudra, fish mudra. Fish will work on your heart. Fish will work on a digestion. Fish will work on the bone marrow, bone cancer people also. So I'm going to help you with all these mudras, okay? So if you check internet, first what will say increasing flexibility. But that you draft, strengthen the muscles, balance, these all postures, these all points, you can put 4, 5, 6, 7 like that. First point, improve immunity functions, improve lung functioning, because you're going to learn 5 box, then 4-7-8 breathing technique, then hasta mudra pranayama. Mudra pranayam will cover in direct or indirect with all the chakras, koshas, panchavayus. So like what we'll say, like full meals. So daily my day starts with mudra pranayam only. Then only I will start my first class at 5:15. Okay. And improve joint health. See, after 35 or after 40, 45, slowly, our bone density will be reducing. Okay, how many muscles are there? How many bones are there? We'll see in the upcoming classes. Already 8. I didn't check. My next people will wait. Okay, I'll finish out with another 2-3 points. Improve function of the feet, strengthening the bones. Then weight loss also you can give, no problem. Mudras also there, pranayam also there, asanas also there. Relaxing nervous system. improve the functions of nervous system. Most important, improve the brain function. Tomorrow class, I'm going to start with the brain, nerves, how it is going to link. And low level of the stress hormones. Stress hormone link with cortisol. That stress hormone, when I'm saying about cortisol, again, indirectly, 4 more hormones also will link. For that, what kind of technique we have to do also, I will tell you. I'll give the names again. When we cover that chapter like pranayama and mudras, you're going to understand. Low blood sugar. Obviously, when low blood sugar, it will be important, right? And contribution also will reduce, improve the psychological way. This all will work. So obviously what happens? Anxiety will reduce, asthma, depression, high BP, menopause, IBS. What is IBS?
Irritable bowel syndrome.
Yes, when you practice few particular asanas or mudras, for contribution, you have 6 mudras. If you can suggest your clients, then definitely they will help it. And pelvic related problems, post heart attack remedies also will be there. We want plan to cover all the topics in 32 classes, but few things which we will link with jalendriyas, karmendriyas, these all means sense organs. Meditation when we do on indriyas means eyes, ears, nose, tongue and all. That is different pattern. So today, 2 more points left what I thought. We are done with first class. Any doubts in the first class, you can ask tomorrow. Okay. Hope if you feel bored, tell me, direct I'll jump with thyroid asanas, thyroid theory, one more day we can plan. Because theory, practical, actually I have to teach in that way. But phases are few are like serious, dull, how I'll understand whether really you guys are following or listening, storytelling, I don't know, right? So if you want me to teach tomorrow only thyroid asanas also, I can go with that. Tell me. Okay, ma'am. For okay, ma'am, what? For okay, ma'am, I didn't even check. Okay, you do one thing. Can anyone text me in the WhatsApp group? So let me sign out again. I have to sign in for prenatal. Otherwise, the same recording will go for 2.5. Then we can't cut. Okay, their class actually 8 to 9. 8:06 I'll log in. Okay, bye. See you tomorrow. Tomorrow before 8 I will stop. Visualization and remaining points I have to cover for the first class pending is there. Okay, bye. Oh,
Bye, ma'am.
See, Vijaya, wait.